Next meridian point is spleen meridian. Location: spleen 1. Location: on the medial side of the big toe, about 0.1 Junes posterior to the corner of the nail. Next, spleen 2. On the medial sides of the big toe, distal and inferior to the first metatarsophalangeal joint at the junction of the red and white skin. Next, spleen 3. Medial and proximal to the first metatarsophalangeal joint at the junction of the red and white skin. Next, spleen 4. Location: and the depression distal of the inferior to the base of the first metatarsal bone at the junction of the red and white skin. Next, spleen 5. In the depression distal and inferior to the medial malleolus. Next, spleen 6. 3 June directly above the tip of the medial malleolus on the posterior border of the tibia. Next, spleen 7. On the medial aspect of the lower leg, 3 June above Sanyin jaw. Spleen 9. Spleen 6. And the depression posterior to the medial crest of the tibia, or 6 Junes above the apex of the medial malleolus behind the tibia. Next, spleen 7. Spleen 6. Spleen 8. Location: 3 June below the medial condyle of the tibia. Next, spleen 9. In the depression on the lower border of the medial condyle of the tibia. Next, spleen 10. To June above the medio-superior border of the patella. Next, spleen 11. On the line connecting Sui Hai, spleen 10, and the N Chongmen, spleen 12. 6 June above Sui Hai, spleen 10. Next, spleen 12. Lateral to the groin, 3.5 June lateral to the midpoint of the upper border of the symphysis pubis, on the lateral side of the pulsatile sides of the external iliac artery. Next, spleen 13. 4 June below the hang, spleen 15. 0.7 Junes superior to the Chongmen, spleen 12. 4 June lateral to the anterior median line. Next, spleen 14. 1.3 June below the hang, spleen 15. 4 June lateral to the midline. Next, spleen 15. On the abdomen, 4 June lateral to the center of the umbilicus. Next, spleen 16. 3 June above the hang, 4 June lateral to the midline. Next, spleen 17. In the 5th intercostal space, 6 June lateral to the anterior midline, mediana line. Next, spleen 18. In the 4th intercostal space, 6 June lateral to the anterior midline. Next, spleen 19. In the 3rd intercostal space, 6 June lateral to the anterior midline. Next, spleen 20. and the second intercostal space 6 tune lateral to the anterior midline. Next, spleen 21. On the mid-axillary line in the 6th intercostal space.
Asterisk lung meridian, Lu, asterisk. Lu 1, location. 6 cun lateral to the anterior midline, level with the intercostal space below the LST rib. Lu 2, location. On the latero-superior aspect of the chest, superior to the coracoid process of scapula, in the depression of the infraclavicular fossa, 6 cun lateral to the anterior median line. Lu 3, location. On the radial border of biceps brachii, 3 cun below the end of the anterior axillary fold. Lu 4, location. On the radial border of biceps brachii, 4 cun below the end of the anterior axillary fold or 5 cun above the transverse cubital crease. Lu 5, location. Located in the transverse cubital crease, on the radial side of the tendon of musculus biceps brachii. Lu 6, location. 7 cun above the dorsalis crease, on the line joining Taiyuan and Chais. Lu 7, location. Superior to the styloid process of the radius, 1.5 cun above the transverse crease of the wrist. Lu 8, location. On the medial side of the styloid process of the radius, 1 cun above the transverse crease of the wrist. Lu 9, location. On the transverse crease of the wrist, in the depression on the radial side of the radial artery. Lu 10, location. On the midpoint of the first metacarpal bone, at the junction of the red and white skin. Lu 11, location. On the radial side of the thumb, about 0.1 cun posterior to the nail. Intestine meridian. Li 1, location. On the radial side of the index finger, about 0.1 cun posterior to the comber of the nail. Li 2, location. On radial side of the index finger, in the depression anterior to the metacarpophalangeal joint. Li 3, location. On the radial side of the index finger, in the depression posterior to the metacarpophalangeal joint. Li 4, location. On the dorsum of the hand, midway between the first and second metacarpal bones, approximately in the middle of the second metacarpal bone on the radial side. Li 5, location. On the radial side of the transverse dorsal crease of the wrist, in the depression between the tendons of M, extensor pollicis longus and brevis. Li 6, location. 3 cun above Yangshi, on the line joining Yangshi and Kachi. Li 7, location. 5 cun above Yangshi, on the line joining Yangshi and Kichi. Li 8, location. Radial side of the forearm, 4 cun below the elbow crease, on the line connecting Yangshi, Li 5, with Kachi, Li 11. Li 9, location. Radial side of the forearm, 3 cun below the elbow crease, on the line connecting Yangshi, Li 5, with Kachi, Li 11. Li 10, location. 2 cun below Kachi, Li 11, on the gene connecting Kachi with Yangshi, Li 5. Li 11, location. When the elbow is flexed, the point is in the midpoint between the lateral end of the transverse cubical crease and the lateral epicondyle of the humerus. Li 12, location. When the elbow is flexed, the depression 1 cun above and lateral to Kachi, Li 11. Directly above the lateral epicondyle of the humerus. Li 13, location. Lateral aspect of the upper arm, 3 cun above Kachi, Li 11. On the line connecting Kachi, Li 11, with Janyu, Li 15. Li 14, location. On the line connecting Kachi, Li 11, with Janyu, Li 15, 7 cun above Kachi, Li 11, at the end of the deltoid. Li 15, location. Directly below the anterior border of the acromion, where a depression forms when the arm is fully abducted. Li 16, location. Upper aspect of the shoulder, in the depression medial to the acromial process and between the lateral extremity of the clavicle and the upper part of the spine of the scapula. Li 17, location. Lateral side of the neck, the midpoint of Futu, Li 18, and the supraclavicular fossa, at the posterior margin of the sternocleidomastoid. Li 18, location. Lateral side of the